YouTube. So it will be a lot of information, but it'll be recorded so you can go back and reflect on it or share it with other people who you think might be interested. We just ask that everyone mute your screens while the presentation starts. And we will be taking questions throughout the presentation. So you can go ahead and put those in the chat box. And then around like the 30-minute mark, we'll open it up for questions. If anyone wants to unmute themselves and ask questions, we can do that later too. But
We'll start with that.
yeah, I'll start with Fusion.
Okay.
So Brooke Grossman couldn't be here today because she has another exciting event, but she's with Fusion Academy, who is one of our sponsors for this series. And Fusion Academy is a campus across the U.S. that are accredited private schools providing personalized learning through one-to-one education for grades 6 to 12. We wanted to highlight them. And then Julie, if you want to take over and talk about the hub.
Sure. Hi, everyone. I'm Julie Pomerantz, and I'm with the Hub Houston. Hub is an acronym for Heard, Understood, Believed in. And we have several different programs. Just very briefly, quick overview. We do have a school for ages 13 to approximately 19, if they need a little bit of extra time with us. We also have a young adult program called Life 101, which is an employability program. We also have Club Hub, which is a social club for ages 18 and over that meets 3 nights a week, one weekend day a month. And finally, we also have Aspire Accessories, which is a program for those that are 18 and over, wherein we hire them to be our artisans and they create magnificent items that are sold online and at markets. And just a quick little note is that we are kind of bursting at the seams in all of our programs. And so we're having a fundraiser open to all on the evening of November 13th at Net Bar's newest location. So it's Net Bar, and it's called Net Bar Shady Acres. I believe it's from 6 to 9 p.m., $25 per person, which covers up to 2 drinks and all of your food. So please consider joining us. And happy to be here today. Thank y'all so much.
Thank you, Julie.
That's awesome. That sounds exciting.
Yeah, it is. We need more space. And so our dream is to get a really huge property where we have all of the young adult programs in the same place. So it's an exciting time.
That is, I love that.
Thank you.
So we usually have Pam Esser with us. She's with ADA-SR, which is the Attention Deficit Disorders Association in the Southern region. And their mission is to provide education, community support, and resources for those impacted by ADHD and coexisting disorders, family members, mental health providers, and educators. So with ADHD Awareness Month, they would be a really great resource for you all to know about as well. And then there is me. I'm Alexandra Roark. I'm a clinical social worker and assistant director here at Houston Neuroscience Brain Center. And this is Dr. Ron Swatzyna. He's the director of our center. He's been in the practice for 24 years. He's published 82 peer-reviewed papers, or probably even more at this point. And so you're going to learn more about him in just a little bit once we get started. But what we do at the Brain Center is we provide EEG services that look for biomarkers in the brain that can account for symptoms. So we have a team of neurologists who look at these EEG reports, look for the biomarkers, and then create quantitative brain maps that can help find causes for symptoms as well. And then based off of those EEG reports, we come up with a treatment plan where we work with our referral providers, and we offer neurofeedback training, which is brain training. And we offer therapy services in photobiomodulation, which we'll get into a little bit of all that stuff today. But on that note, we will go ahead and get started. So today we're going to be talking about ADHD. What is it? What does it look like? You know, what are the treatment options, and are there non-medication treatment options? And so I'm going to be interviewing Dr. Ron, kind of like casual Q&A style. And like I said before, just feel free to add any questions as we go in the chat box. And keep an eye out for him. But my first question for you, Dr. Ron, how long have you been treating children with ADHD?
I started, I guess, back in '97 when I first got out of grad school. Jeff Lewis and I we're in the same cohort at grad school. At least my master's was with Jeff. And this has been a lifelong journey for me. Of course, in the 60s, 50s, 60s, 70s, when I grew up, they didn't even have the diagnosis of ADHD. So, we had different ways to handle obnoxious boys in our generation, to say the least. And it worked quite well. But I experienced a lot of the same issues. These young kids are impulsive through the roof. But one thing we always want to remember about ADHD is if you harness its energy, it's very powerful. So to start back then here in Houston in 2003 with ADHD kids, it's been quite an exploration. I worked for Dr. Tarnow at the Tarnow Center for 17 years and worked with the medicines very closely. So I've got a good idea about medicines, about the genome studies and everything else. And that can be very beneficial in a lot of ways. We could bury ourselves deep into that conversation, but it's been a very rewarding path to get here. And I think we're refining it more and more every day.
Oh yeah, whenever I've heard about like your progress of like where you started and your time at the Tarnow Center and what's led you to where you are today, it's just truly incredible. And we have a lot of exciting case examples today too. So we won't get into those just yet, but it's been really incredible to hear about the changes in lives and how working with like EEG and neurofeedback and other things like that. But on that note, so people say not all ADHD is created equal. Are there different types of ADHD?
Well, let's look at the DSM originally. Back in 2009, Dr. Thomas Insel, who was the director of the National Institute of Mental Health, came out with a statement that said that the DSM is not a valid instrument. Now, that was a big statement to make, but we've all known that diagnosis in mental health is mostly just based on behavior, based on assessments of somebody's behavior and some psychological testing. But it measures psychological testing, psychoeducational testing, measures level of impairment, great, but it really doesn't tell you what's causing the problem. So with ADHD, there's a lot of different things that can cause ADHD. The traditional one are young children that have maybe a very slow brain, meaning the firing frequency, the peak alpha frequency is slow. And alpha, when we're young, starts out slow, and until we hit about the age of 14, it maxes out. And then at my age at 70, it starts slowing back down, kind of like the circle of life. But in children, if they're maturationally lagged or if they're developmentally delayed, this can present as an ADHD, a hyperactive, inattentive ADHD. And it's because their brains aren't maturing at the rate of what we would like to see them mature, what's normal.
Yeah. So some people here might not know what you mean by alpha peak. Do you want to give them a little clarification?
That's why you're here. Okay. Alpha is the timing frequency of the brain. It's what I call the metronome, and it comes from a specific region in the brain called the thalamocortical projection system, and it's what gets everything to the right place at the right time. And so alpha is very critical. As we speed up the alpha until we hit about 14 or 15, that really helps us with memory, with cognitive performance, and everything else. So when it starts slowing down in our 70s and 80s, that's when people get there's a lot of frustration and everything else. So yes, when you start slowing down even earlier than what we'd expect when you're older, it can produce the same types of inattention behavior that we see in younger people.
Right. So what I'm hearing you say is, with the DSM, they do talk about two different types of ADHD. But like here, you're able to see different types of ADHD based on the EEG, which is the recording of the brain.
Sure.
So one of them, you can look to see the alpha peak, and if that's lower, then that could be a potential cause of ADHD. Is there another neurobiomarker?
Sure. We have the frontal midline theta. Theta is a slower frequency, and these are the ones that we see in a lot of children that has more to do about the dopamine in their brain. In fact, we know that excessive video gaming will create this type of ADHD. There are neurofeedback system made to make the brain so it's more, has to have higher stimulation in order to keep its attention. So when the teacher gets up in front of a person who does a lot of gaming and they're not jumping around like Big Bird, they really don't, they can't pay attention to the boring teachers for sure. And so that's another type. A third type, which is kind of a similar, but it has to do with serotonin. And this type produces a specific brain wave that has to be, it's a lot of alpha in the frontal lobes. And it's more of a distracted by their own thinking. Their brain's supposed to be paying attention in class, but it's out chasing some little rabbit down a rabbit hole, and they get distracted by their own thinking. So that's a third type. Fourth type of ADHD is the anxiety-based ADHD, which has spindling excessive beta, and beta is a high frequency. Beta is good unless it's excessive and it's spindling. Then it messes with sleep. It messes with arousal, ability to attend. So, and it is a fourth type that's completely different from the other three and takes a different intervention of medicines and everything. If we're looking at, medicines that would be targeted to the specific brain, yeah, the slow alpha would take an amphetamine because that adds norepinephrine, speeds up the brain, speeds up the alpha peak. Methylphenidates, it hits the dopamine. So dopamine would be the second type for the frontal midline theta. Selective serotonin reuptake inhibitors actually address the frontal alpha like this, which does help them to attend, has more to do about serotonin. And the spindling excessive beta is more addressed with the intuitive, which is your old guanfacine, the alpha-2 agonist that they came out with about 2009 indications for children. So there are matches to certain patterns in brains.
Okay, so that's really cool. So you're saying, like in some cases, if you're able to look at the brain and you're able to see a certain neurobiomarker, which is a term we use for identifying these causes, but so you're saying you could see if there's a medication that's the best fit.
Sure. That's what I've been doing for 20 some years is targeting medications to the brain, not just to the symptom, because the symptoms can all look the same. There's another type of ADHD, which not many people realize, but head injury can cause ADHD symptoms. And no medication is going to work on a head injury because a head injury is usually in one spot only, and you can't tell medicine, well, go to that one spot, leave the rest of the brain alone.
So then would it just be treating the brain injury, which would then make the ADHD symptoms go away?
Yeah, you'd have to treat the brain itself. You can't, a medicine would not work. So it had to be more of a non-medication approach.
Well, earlier, whenever you were talking, I think it was the third type that you mentioned for distracted by your own thoughts. That made me also think about earlier, whenever you were making the comment of like back in the old days, how they would treat obnoxious boys. It made me think about how ADHD in girls is typically not as noticed. Do you think that's because maybe they are more likely to get the third type of ADHD, or?
That's a good question. Logically speaking, that would be true because we don't find as many girls with immature brains. We don't find as many girls addicted to video games needing high stimulation. We do find a lot of distracted. Yes, if you're just sitting there in class and distracted and by your thoughts and thinking all these things, and of course the hormones are, when they hit puberty, start raging, that can distract you quite a bit too. So yes, I would say that would probably be pretty consistent. Spindling excessive beta we think is related to possibly neuroinflammation, COVID brain fog. You've heard this term, brain fog. It's what we find related to that specific pattern. But that's less in children than in adults.
Less in children. Interesting. Well, that's really fascinating. I know that is a lot of information. So if anyone needs any like repeats of any of that later on, just let us know. But we've kind of been dancing on this topic, but I've been hearing you say a lot. We need to look at the brain to know what's causing the symptoms. Could you just explain a little bit more about what that means?
Well, the electroencephalogram, the EEG, is what we do here. And then we have it turned into a set of brain maps. That data is turned to, we don't do brain mapping here, we do EEGs, and then they're made into brain maps using that data and have them sent back to us. And so the EEG has the ability to give us all this information. And the four things that account for medication failure and all of it and all of psychiatry are for the biomarkers that we mostly talked about, except for the biggest one. We talked about focal slowing, like we have in brain injury, one spot of the brain slower than the other brain. We've talked about spindling excessive beta, which is a higher frequency anxiety-based ADHD that affects sleep. That can only be seen in the EEG. We haven't talked about encephalopathy. Mm-hmm. Encephalopathy is really an interesting one. That's the brain. It's a brain disease or something that is preventing the brain from being supported by the body. And the most common things that we have found have been issues with hypoxia. For instance, children who are not getting enough oxygen at night while they sleep actually delay the maturation of the brain. And so tonsils and adenoids sometimes have to be removed in order to open their airway enough to let their brain speed up to normal speed. I had two children, one 6-year-old and one 8-year-old, that had this pattern, and they both had experienced ADHD symptoms, definitely a lot of ADHD symptoms. And I think this was a big deal that we found this out, because you can't treat obstructed airways with neurofeedback, with psychotherapy, with behavioral therapy, or psychiatric medications. So that's one of the reasons we found children and adults, but with thyroid issues, and a low voltage slow EEG could be due to a thyroid malfunction. Again, we can't treat that with anything in psychiatry or psychology. That has to go back to the docs to look at supporting their thyroid. The fourth is, we have found now, thanks to Hurricane Harvey, a large amount of children are coming in with ADHD symptoms that it's because their houses, unbeknownst to them, even though they were repaired, they still have mold throughout their houses. Now, people ask me, should we have somebody come in and inspect the house? I say, no, just have a urinalysis done of your child and see if they've got mold in their system. If they got mold in their system, then you need to check the house and have that remediated. But let's check and see. The simplest thing to do is just get a good tox screen, and when you do get a toxicology, we want to see heavy metals as well, because we run across heavy metals such as we've had lead toxicity come across our desk. We've had what was the other? Well, now let's talk about the toxic metals. And we've just recently had arsenic, which was really surprising to me. That came across us. So, there are toxicities that do pop up from heavy metals, but then we've talked about also the insecticides and the herbicides. Roundup is in a lot of trouble with a lot of places, a lot of lawsuits, but they're still advertising it to spray in your backyard and let your kids and dogs run around in a weedless backyard, but then they're getting toxic levels of Roundup in their brain. And that's a case that we had earlier this year, which just really blew us all away. And then the herbicides, although we think that we're pretty safe from herbicides, I don't know what the effect is on children, and we need to investigate this. We have our house sprayed every so many months. And they go around, they spray the insecticides. Is that a problem? They don't want you to have your pets in there when you do it, but is that a problem? So,
I mean, on that note, we will be having Dr. Tracy Southwick on November 15th talking about herbicides and pesticides. So if that sounds interesting to you, make sure to sign up for our next one. But I mean, that's really incredible that you're able to see signs of that in the EEG.
One more thing we hadn't covered. We got through encephalopathy. So we got the three things so far that we can see on the EEG, which is spindling excessive beta, focal slowing, and now we got encephalopathy. But the fourth is probably the one I've published the most in, and it's isolated epileptiform discharges. They call them silent seizures, but they're really not silent seizures. It's seizure activity that may not be serious enough yet to hit the central motor strip to cause a full convulsion. But in ADHD children, a study was done in 2012 by Millichamp and Stack, and they found a 25% prevalency rate in children with ADHD had isolated epileptiform discharges. We, and you were on that paper, she's been with me since 2014. We published a paper replicating that study and found 32%, but our population all failed on medications. So if 1 out of every 3 children that fail medication has spike and wave activity, seizure activity in their brain, that is made worse by stimulants, by SSRIs, SNRIs, NDRIs, lithium, antipsychotics, most everything but an anticonvulsant makes the seizure activity go down, a level of the seizure threshold reduced, which makes it more likely to propagate this type of activity in the brain. And these are the kids that would, they may have to read and then reread and reread a third and fourth time because they've got these little spike and wave activity. Usually it's in the temporal lobes, in the language area, that is misfiring, and it's causing you to miss in a second. How many words do you read in a second? 2 or 3 or 4. You have to go back and reread to get the full potential. So I know we have a person from the ISD here, and that would be some of those cases where they're really trying hard, but they're just missing it. And so it's one of the things I really want parents to know about. If we don't catch it, if they have them on those medications, the second most prevalent time for a child to develop epilepsy is in the puberty years, because that's when the neurochemistry gets really excitatory and, again, lower seizure threshold. And if they're on the wrong medicine, it all comes to a terrible storm and can present itself as a full convulsion. And then you have it wiring together and it's likely to repeat itself.
Yeah, I mean, it's been incredible. It makes me think about, whenever you talk about your experience with the previous psychiatrist that you worked with, and how whenever you talk to him and you're like, let's give these anticonvulsants a try, and you saw huge improvements in all those cases, correct?
Right. And the neat thing about it, and it's been our experience, that anticonvulsant sounds like a very scary thing, but when you target it to the right anticonvulsant to the right brain, again, speed of the brain makes a difference. But when you do that, we found that if we can find a child, middle school, early high school, put them on an anticonvulsant, do neurofeedback at the same time, you don't want to pull them off the anticonvulsant until you get them to the other side of puberty. But when they hit their senior year, second semester, we do an EEG, see if there's any spikes. If there's no spikes, we titrate it down 50%. No spikes, titrate it down all the way off, no spikes. And we've never seen them come back. So it's like we fixed the problem. Some medicines in psychiatry that will actually fix something, not just patch a problem.
That's
interesting.
Yeah, that is interesting. And then I guess that's good to know too. Like you said, it could be scary to hear that word, but it doesn't have to be a lifelong med that you're dependent on. It can fix a problem. And then, I'm thinking about what you were saying about the obstructive airways causing ADHD symptoms. And that case, I mean, I came on as your research assistant in 2014, and I think you had already seen them, because I remember you telling me that story, and I had never thought about this before, how there can be other causes for ADHD besides just having it. Like I had so much to learn, but that was such an interesting case. Do you want to share a little bit more about that case with them, on how you were able to treat it and if those symptoms went away?
On the ones that were sleeping issues? Well, that was the fact that we did get once I sent them to the sleep lab, and they verified that they were only saturating at night at about 92% or less, and it was keeping their brain from maturing. One of the ENT surgeons was willing to take out their tonsils and adenoids, and I took that out on both boys, and we did 3 months follow-up. The ADHD symptoms were going away, and we ended up their brains had sped up to normal speed in a 3-month period of time. So we fixed the problem instead of treating the symptom.
Yeah, because imagine what would happen if, they went to a psychiatrist or doctor and they're like, oh yeah, these kids have ADHD, let's put them on Adderall. That would have just made their sleep even worse, and it would not have fixed the problem, because we wouldn't be getting enough air.
Right.
Wow. So, what are some signs that parents can look out for if they're concerned that their kids might have ADHD?
Well, sleep is probably the number one issue that all children have that are diagnosed with ADHD. And so, which came first, the chicken or the egg? Is it the sleep causing the ADHD symptoms? Which check, yes, that is true. It can cause ADHD symptoms. Can a pattern of ADHD cause sleep issues? Check, yes, that could be a spindling excessive beta if they had COVID and now they're not sleeping as well. It could be that as well on both ends of the stick. So I think sleep is the main thing. We find that ADHD children don't particularly have the most healthiest lifestyle. Boys tend to be doing the more dangerous things. Just fact of life. I did quite a few of them myself and still survived. But that type of behavior, what do we want to protect our children from? We don't want to protect them from making mistakes because that's how they learn. But we do want to keep them out of harm's way if in any way possible. So again, back to the ADHD, is it a disadvantage? It surely can be. But what can we do other than that to help them out? Children with ADHD, you stick them on a stimulant and they end up maybe behaving better in class, but the long-term studies have shown there's no additional gains in education when those with ADHD that never take medicines versus those that are medicated for ADHD. Definitely, there's no change in educational gains, but the teachers are much happier because they can tolerate them better. So that's the big difference.
Yeah, and I guess thinking back on what you said too, it's like some other signs could be if their kids are reading and they're having to reread and reread, then it could be one of those spikes you were talking about. Or if they do seem to be more distracted by their thoughts. Sometimes you can kind of like see that when their eyes are like glazing over, then maybe that could be.
Well, and also if they like to play video games because they need more and more stimulation. Maybe they're ADHD and that's the ones that like to play games because it's highly stimulating for them and they'll get more pleasure out of it.
It's true, because whenever you're playing excessive video games, your brain is increasing the theta in the frontal lobes and that causes the distractibility.
And it wipes out your dopamine system, which then means that's why methylphenidate would probably address that. But we always should look at lifestyle. We should look at their nutrition as well.
Yeah, that's my next question. That's perfect transition. I was going to ask, what are some lifestyle choices that can help manage ADHD?
Well, of course, I thought it was quite humorous and when we used to carry remember the big candy box, and we would give kids after they leave candy.
Therapy.
Therapy. Talk about job security. That probably wasn't the best plan, but sugar highs can cause those symptoms to be exacerbated. So, we really need to watch the high carbs and sugar intake of children, all children, not just at children with ADHD. All children's brains do not function well on a high sugar, high carb diet.
You did a study on that.
Yeah, I did.
And it showed that kids who ate high sugar and high carbs, their EEGs showed that they would have more ADHD-like symptoms.
They would have more ADHD activity, the higher theta activity, right?
And then it was normalized whenever they had a well-rounded
balanced nutritional breakfast made all the difference in the world. And so we're looking at, a healthy lifestyle also includes exercise. And I think this has been something that's been tremendously underlooked at and dropped from school schedules. And it's sad because they need that physical exercise terribly. And if they're not involved in the sport, how much exercise does a child normally get, especially if they stay in most of the time? With the staying inside is not healthy. We need them out in the sunshine. We need them running in recess and playing. That's very healthy for those brains.
Yeah, I mean, it's very important to look at those three factors. I always call it going back to the basics, because if those things are all checked off, the sleep is good, they're eating well, good amounts of protein, they're moving a lot, and they're still having attention issues, then yeah, that is a sign that there's something else underlying going on. It's more than that. But I mean, the basics have such a huge impact on our functioning. So that is very important to assess.
And so on the nutrition, across the board in neuroscience, we find that a keto diet is more beneficial for every brain, not just for ADHD brains. So we want to give them every advantage possible, but I guarantee you we can't outrun an unhealthy lifestyle and do any do much good with it, you know.
Yeah.
And so we do need to go back to the basics and really let's look what kind of lifestyle contribution that's making their symptoms worse. Just like we know there's a direct correlation between the amount of hours video gaming and the increased negative behavior and the decreased educational accomplishments.
Yeah. You know, some other lifestyle factors that I'm thinking of that I want to ask you about. What do you know about like red 40 on ADHD? I mean, I've heard the dye, red 40 dye, or like EMF. I mean, do you have anything to say about those things?
Red 40 is outside my area of expertise. I don't mind saying I don't know because I don't know a lot. But now on the what was the other?
EMF.
EMF. Oh, electromagnetic fields. I have in my office electromagnetic fields are what we have from our computers, our routers, our cell phones. Do you know you're not supposed to hold your cell phone against your ear because of the penetration? This is an EMF meter that we loan out to people who are interested in assessing their house, especially where their children sleep. Because if the router's anywhere close to where they sleep, it's going to create all sorts of issues. A pediatric neurologist, Dr. Turner, who does all of our reports, he's with the World Health Organization and actually does presentations and publications in this area. EMF is a big deal now, and we're seeing a lot of kids develop symptoms just because of high rates of EMF exposure. Now I've got my blue light glasses here. I'm not wearing them right now. They should be having the blue light filters on their computers, sleep hygiene. They should shut their systems down. They shouldn't have their phones by their bed. Again, this is all, it's really impacting children's brains more so than adult brains because children's brains are changing rapidly. And so that's one of the things that we can get into a whole presentation on that. And Dr. Turner has done one of these with us, actually.
That's true. We do have one of those on our Houston Neuroscience Brain Center YouTube channels if you wanted to go back and hear more about him and his research. But it would be good for us to have him back on. That would be good because there's probably been more updates since then. Can you think of any more lifestyle choices? I think we covered a good bit. So my next question is ADHD often misdiagnosed? And if so, what are other causes? And I ask this because my brain goes back to thinking about how trauma impacts the brain, how it impacts the body. And then I'm wondering, like whenever you experience a traumatic event, it can be very overstimulating. I'm wondering as a result if our brain will increase the theta in the frontal lobe, similar to the video games, as a way to like protect itself, and that can cause inattention, or if you have any thoughts on that.
Well, trauma itself, whether it's physical trauma or psychological trauma, creates a certain pattern in the brain which we can recognize. And because we treat a lot of brain injuries with post-traumatic stress disorder, the dual combination. So it's really rough when you get that dual combination. But trauma itself, the first thing that happens is you lose your sleep. And when you lose your sleep, you're going to exhibit these symptoms. So people who go through all their life without an ADHD diagnosis and all of a sudden experience a trauma, then they get ADHD diagnosis. It's like, that's interesting. Why did it develop that late? Well, it's the symptoms that develop because of the trauma. And this is something that can be treated, but it's not successfully treated with, there's a medicine for reducing that type of activity in the brain. The SSRIs have been known to do it, but then again, you got to match it to the brain, see if that's what it needs. But neurofeedback is a really good way with the EMDR to process through the trauma to get to the other side.
Yeah, that is true. An EMDR neurofeedback combo.
I tell them about EMDR.
Yeah. So EMDR is a type of therapy. It's eye movement desensitization and is it reprocessing? I'm not certified in it. He is, but so you might be better at explaining it.
It's a very rapid way to work with trauma so that the people don't have to worry about saying a lot of things. But it is a way for your brain to actually process through what it experienced without the emotional attachment and then restore it in a different way in which it's not going to invade your life. You can find a reason for it. You can get to the other side, basically. I really like the therapy. It's very good when implemented at the right time with the right brains.
Yeah, I've heard some really great things. So, with that being said, what is the most important thing parents should know about ADHD? I know you talk about the superpower part of it.
Well, yes. The great thing about ADHD is no really doesn't cause us any grief. We can take no and find a different way. I've had several papers turned down the first time and repackaged it and send it off and go for it the second time to another publisher. It's a lot of energy. It's a willingness to, if it wasn't for ADHD, Christopher Columbus would have never sailed to the edge of the earth. Of course he was ADHD. All the explorers are ADHD. You don't do those kind of things. The first person to try to fly an airplane, those guys that jumped off with those wings and thinking they could fly and flapping those wings, and of course they crashed, were all ADHD and now brain injured. But it's just part of what we need in our society. I think it's just a subset of humans that we've got to have that are willing to be the hunters and not the gatherers. You got to have your farmers, but you got to have your crazy people go out there. They have superior navigational skills. They have a lot of tenacity. They can get through the very difficult things and come back with the food so everybody eats. So I think that it is a superpower, but it's learning how to manage it. That's the most important part. Like I always remember, I've been told, if you're going to do something, how are you going to make money with it? Well, if you find a way to let that superpower make money for you, that's really the golden part, because all the inventors are all ADHD because they think outside the box. So that's why I say we got to look at it differently and not think that it's so much of a deficit, but how do we harness it and how do we get the kids through this period of time so that they can see their full potential?
I love that. That's true. It's like ADHD can come with some frustrations, but there are tips, treatments, tools out there that can help you manage that. And then it sounds like, and you in your experience, you found a lot of beauty and fun with your ADHD.
Luckily, I lost my draft diploma after flunking out of college my first year. And my draft number came close. And so I joined the Air Force to stay out of it. Well, that didn't work, but I did enjoy the possibility that I now could get very well organized, because the military's way of thinking, getting up early, staying on a real regimented course, everything is basically, I'm here every morning by 6 o'clock. I leave every day by 4 o'clock at the latest to beat the traffic. There's just ways to make that lifestyle become permanent. I've had 17 years military between enlisted and officer, and it's really made a big difference on how I can accomplish anything I set my mind to, because that's what they teach you. They teach you how to harness that energy.
Yeah. That reminds me of, I want to just do a little plug for Staying Ahead of the Game. They are a service that provides tutoring, but on top of tutoring, they also teach executive functioning skills and organization. So I think, if you're looking for extra help in that area to learn how to manage it, they would be a good resource. Well, I have one more question for you, and then we will open it up to everyone else. So you have talked a lot about medications and how you can use the EEG to find a good match. And there are cases, where medication can help treat ADHD. So we also want to talk about some non-medication options, neurofeedback being one of them. Could you talk about how neurofeedback can help treat ADHD and the research behind neurofeedback training?
Well, I'll talk about the research behind it. And they started using neurofeedback to treat ADHD back in the 70s. But again, because there's nobody paying for the research like a drug company, of course, the early studies weren't as good as they can be. Right now, we find the side-by-side studies that were done with neurofeedback versus methylphenidate, the neurofeedback outperformed and lasts longer. The neurofeedback is a treatment, a training, not a treatment. So it is basically training your brain to process better. And that's what we want to see. How can we optimize the function of every brain out there, regardless of where they come from? Either our peak performance work with superior performing people just to give them a little more edge, like a higher score on their ACT or SAT. It's an advantage, you know. So if we can tune that brain, we can make that brain work optimally, and that's the big deal.
Yeah, you just recently had a client who did an IQ test before and after, right?
Yes, that was an interesting case. The industry shows that there's between a 12 and 23 point increase in IQ scores. And I don't think it's IQ. I think it's access to IQ. And so I told this mother about this study, and she has had her child tested probably every year. And how old was he? About 8 or 9 years old, maybe a little older, maybe 10. And they did 10 sessions of neurofeedback. And before, from test to test, it never varied more than 1 point, 2 points higher or lower than it was the time before. She came back in just really happy and singing the praises of neurofeedback because she said it was 12 points. He gained 12 points in his IQ score. And I was going, after 10 sessions, I wasn't expecting that. Usually it's 40 sessions we look at, that's the norm, but 10 sessions is surprising.
Yeah.
But that is, again, when you can link those, make those connections that are missing, it really does help a person achieve their full potential.
Yeah. So, and with the neurofeedback training, what that looks like, it's using operant conditioning to train the brain. So it's giving the brain a reward whenever it's doing what we want, and then it takes away the reward whenever it's not matching. So the system is reading the brain waves in the area that we're training, and we use a movie as a reward. So whenever their brain is matching, the screen is bright and they can hear the sound. And then whenever the brain isn't matching, the screen will dim and the volume will dim, and the brain picks up on the connection. And so it'll want to start keeping the screen brighter. So that's just a little teeny tiny summary of what that is. But yeah, we have more information on the website, or if y'all are curious to know more about it, just let us know in the chat. Or if you want, you can just unmute yourself and ask us questions. I know this was a lot of information.
So we're going to open it up now. Any questions?
And then as y'all are thinking, I'm gonna just put our information in the chat box.
I had a question about the frequency of meetings for those sessions. Is it generally once a week for how long? Like an hour, 30 minutes? And
well, the sessions are 35 minutes of training. It takes 10 minutes to hook them up, 10 minutes to disconnect. So you're looking at about 55 minutes session. Industry standards requires at least 2 sessions per week for the brain to learn. The more intensive, the better. We actually have brain camps in the summer and in the winter break where we do double sessions, which would be 70 minutes of training 5 days a week for 2 weeks, and we can get 20 sessions done pretty quickly. And the brains on these, anybody really, I had a 70-year-old doing that one, 78-year-old.
Really?
Remember her? She came back in 2020 and did another 40 sessions like that intensively. So that's we like at least 2 sessions a week for the brain to learn. And if you can take breaks after a period of time, we don't want to do 1 or 2 sessions and you leave for 3 weeks. We'd rather keep it pretty consistent. But if you can get 5, 10 sessions out of the way, that will stick. Okay. I hope that answers it for you.
yes, thank you.
Sure. That's why we do a lot of work in the summer during winter break, because I don't want to pull kids out of school unless it's absolutely necessary. And they have so many functions going during the year, football or band or whatever. It's just kind of makes it kind of difficult. So we know we've kind of got to work around that schedule. Any more questions out there? I don't know where my lady is.
Have you seen it all with insurance as far as covering the sessions
That's a good
for
question.
kids?
Yeah. Insurance in the state of Texas we have found that they're starting to cover for 3 diagnoses. ADHD is one, substance abuse is another, and traumatic brain injury is the third. So yes, the ADHD seems to be one that they will cover, but insurance they like to get away with not paying for anything as long as they possibly can. The state of Texas found that for brain injury, insurances have to pay from the state of Texas, have to pay for neurofeedback treatment. If not, you can take them to court and everything else like that. But that's under that. And substance abuse in the state of Texas is considered a brain injury, which is kind of fascinating. So, but the ADHD part, we are seeing that more getting it covered, and especially the mothers who want to dig in and fight with the insurance companies, they can get it covered. But it's something that they're always going to try to turn down originally.
Thank you.
You're very welcome. Good question. I hadn't even thought about talking about insurance. Yeah, it would be nice to have it all covered. But I have seen one mother when we were at the other center, and she got all her kids and her husband and herself covered.
You really had to fight for that, didn't she?
I would not have wanted to be on the other side of that phone when she was on the phone with them. I heard her a few times. They were tough conversations.
Gotta do what you gotta do.
But when your child has tried everything else, obviously, what are they going to do? When they've tried 1 or 2 or 3 medications, they failed. When they've tried behavioral, they failed. The insurance has got to be able to authorize that. Mm-hmm. Any more questions out there? Julie, you got any input?
Not at this time with regard to ADHD, although we do have students and young adults who come to the hub who are diagnosed with ADHD, as well as autism, anxiety, some depression, etc., wherein we are able to work very closely with them and the families. We keep our ratio incredibly low so that there's a lot of support and communication throughout. So. Right. And then again, I would go ahead and put an extra plug in for Pam Esser, who couldn't be here with us today, who does lead the ADDA Southern Region. And she is just an enormous wealth of information with regard to this subject. And they have conferences throughout the year. She does a lot of, webinars online. So that would be a great place to reach out to.
Right. And that just triggered one more memory, one more thought about ADHD. Neurofeedback for ADHD is not a standalone intervention. You've got X number of years of ingrained behavior that has to be altered. And so I think that that's a valid point that we all need to know, is that we like to do the therapy with them. Sometimes it's doing family therapy as well. Because if you leave the family out of the equation and just say, fix my kid, there's a problem with that. It's a whole family issue. And so we've got to do things different in the family, maybe from changing the diet, maybe from exercising more, watching the sleep schedule, but it's a family issue. So the therapy part helps get at the behavior, but the ADD treatment with the neurofeedback helps us fix the abnormal connections in the brain so that brain can operate better. Mm-hmm. And the last thing we want to do is send our kids off to college with untreated ADD and they'll be back failing, or treat them with stimulants. And then guess what? They don't take their stimulants on the weekend, and ADD is still a 24-hour issue. And so they're driving, they're impulsive. Mm-hmm. Most kids that have ADHD have a higher accident rate with driving too, because their distractibility. So that's part of it as well.
Good point. Yeah, it's not a standalone treatment. Well, we have about 1 more minute. I did put Dr. Ron's email in the chat. If you'll have any other questions, or if questions pop up later, feel free to reach out. I also added Pam Esser's with her email if you wanted to reach out to her for resources. Our next webinar will be Wednesday, November the 15th from 12 to 1 p.m. with Dr. Tracy Southwick, and she's going to be talking about pesticides and herbicides and how you get them and how to treat them and what impact they can have. So we just really appreciate y'all hopping on here today, and we hope to see you next time. Keep an eye out in your email for the recording and then the registration link for the next series.
All right, guys, thanks a lot. I'm going to stay on in case somebody wants to chat. No problem.
Good to see you, Jeff.
All right. Bye, guys. Have a good afternoon. Thank you.
I had one more question.
Ma'am, sure.
I was wondering, do you happen to have any current studies like ongoing that you're doing at the moment?
We've got several papers in the process of writing. Um, we are we are self-funded, so there is no research funds for doing particular studies. What I mostly do is collect data from everybody I've got coming in, and then analyze that data over time to see, what are the prevalence rates of these different abnormalities and what we can do to intercede on them. Is that what you're talking about? Maybe getting involved in the study?
Yes.
The problem with, particularly in children, which are special groups, uh, we do have an IRB, but those, if you're going to do any sort of intervention with children, it takes a higher level IRB in order to get that done, because pregnant women and children and prisoners are all special populations, and we want to make sure we take care of them. Not that neurofeedback would do anything that's harmful to children, but it's just we haven't gone to the outcome studies like that. We've done it with the medications because they have been medicated, and done pre and post on that kind of stuff. But it's something we encourage a lot of people that have those kinds of funds set up to do those kinds of studies can do, because I do think outcome studies are very needed. But it's something we haven't got into. I just mostly collect the data from everybody coming in, and de-identify that data, and then use that data for prevalence rates and other ways to test, other statistical methods to test its ability to at least identify what we want to identify.
Thank you.
You're welcome. So Jeff, you still there?
But I
Yes.
do have a question. It's the first time I hear about this therapy, and I mean, I didn't really understand well what it was and what's the benefit and how to decide whether it's better than medication. Can you explain, repeat what you already said? Or
Sure. Well, in neurofeedback, we want to, using neuronal plasticity, we want to use the brain's ability to wire itself differently, more effectively, so that we can make up for the problems that it's having. And so, but medication is only a patch. It works well at the time for doing certain things if it's matched to the correct brain, but then you take the medication away and all the symptoms come back. So neurofeedback's different in that it fixes something. It's like gaining the skill to play the piano or ride a bicycle. It's operant conditioning. So it's a permanent change to the brain to help it function better, so that you don't have the issues of distractibility and hyperactivity and everything else. We also use it for helping brains that are even have epilepsy become more functional. And so that's something that we really enjoy doing, is working with the epileptic population, because they're some of them just don't respond to the medications. So that's why we like a non-medication option. And the side effects of the medication sometimes negates any gains you would have out of it. The stimulants, suppress appetite, which if you're hypoglycemic, your brain's going to be more distractible, and they affect sleep. And they should be having an EKG once a year, because they do affect the heart rate. They do increase the heart rate. So it's all these things that there's positives and negatives with everything out there, and that includes medicine. Now, the negatives for neurofeedback: time and money. That's the downside of it. It takes an investment of time, and it takes it can be costly, depending on how many sessions you need. But that's why I like to explain the difference in the two. And if you go and do a word search on neurofeedback and its history, it's got a long history out there, and it's the National Institute of Mental Health. If you go into PubMed, Medline, type in those words, and you can get access to a lot of really good research out there on neurofeedback. I hope that helps.
yeah, thank you. You were talking about the time of treatment. So on average, how long would it take?
Well, for traditional ADHD, we find 40 sessions is adequate to retune brains, unless there's something else going on, so that they won't need the medicine. And that's twice a week for 20 weeks. Or if you do it more intensively, of course, it's less.
Okay, and you were talking about the price earlier without any
Oh,
insurance. How much?
without the insurance, it's $140 per session.
Okay.
Okay. But like I
Eh,
say, it's a permanent solution. The
Okay.
changes we make in neurofeedback stay in the brain unless you have drug and alcohol abuse, toxic exposure, or a brain injury. Obviously, those are going to mess up a brain. But other than that, it's just like learning to play the piano. Once you've learned to play it, you may be rusty years later, but you still have the pathways in your brain to play the piano or ride a bicycle. So it's sometimes we do tune-up sessions, but sometimes we just get kids coming in from college on spring break or winter break that want to do a few more sessions just because they know it makes their college easier and they don't have to study as hard because their brains are more efficient. So we'll work with anybody like that.
Sorry, does it work with any type of ADHD? Because you mentioned several types, or just ones are better than others.
Well, the encephalopathy, I like to hold up until we can get the toxins out of the brain or start the chelation of the toxins out of the brain. If it's tonsils and adenoids, we're probably not going to start until we get the tonsils and adenoids removed. If it's a thyroid issue, we've got to get the thyroid fixed before we go into it. So that's why we're so successful, because there's a lot of cases we don't start neurofeedback with just because of the fact that they're not appropriate. We've got to figure out what's preventing their body from supporting the brain. The isolated epileptiform discharges, excellent for that. Neurofeedback is great even without medicines to help control that. I like it with the medicines in conjunction with, just because I think it's a little faster. Use the medication to stabilize it and the brain to make the pathways permanent. But so those types of things, I do see that there's a big advantage for the neurofeedback. Are you interested
Okay.
because you're a practitioner or because you're a parent?
No, I'm a parent. My son is 17 and he's on medication. He's always been, and I'm thinking, yeah, if something else works, that would be great, especially him going to college. And there's no, any age. It's okay at any age. It's never too
Yes,
late.
we start them as young as 4. That's just, they made me go down to 4 already. Some of the children, I've got a 6-year-old that's just a great trainer. And we go all the way up. My oldest has been 78. So yes, any age we can, and I do a lot of brain injury work out of our center here. And those are really, really difficult cases, may take a lot more sessions, but when you give them somebody skills that they lost because of a brain injury, it makes a big difference. So, love to see your son. I think this would be a big advantage, especially before he goes away to college, because a large number of ADHD kids, especially boys, wash out the first year because they can't self-manage well enough with the brains that they have. I know I didn't with all my brain concussions playing high school football, so I was
Okay.
not ready for college.
Well, thank you very much. And you're based in Houston, right?
Yes, ma'am. We're 1 block north of 59 on Kirby.
Okay. Thank you. Thank you
Yes,
very
ma'am.
much.
Yeah, you take care. All right, guys. I guess I'm going to shut it down if there's nothing more. And I appreciate everybody attending. Thanks again. Bye-bye.